So good morning. My name is Tarsha Weaver. I am the director of MeHI's eHealth services. The purpose of this event is to provide health IT education with a focus on supporting providers with stage 2 meaningful use. How many people in the room will be attesting to stage 2 meaningful use this year? Congratulations. You guys have been on this journey for a very long time, so thank you. EHR incentives are helping to build the IT foundation to support healthcare organizations and providers with practice transformation and transitioning to payment models that are focused on quality and performance. Meaningful use enables the delivery of higher quality of care. Massachusetts hospitals and providers continue to make great strides with achieving meaningful use. In a few minutes, Laurance Stuntz, the director of MeHI, will be sharing with you the Massachusetts landscape on how the state is performing. I would like to take this opportunity to thank our state partners, the Executive Office of Health and Human Service, specifically Mass Highway, the Department of Public Health, and Mass Health. I also would like to take this time to to thank industry leaders from the Reliant Group, Blueprint, HealthCentric, Mass eHealth Collaborative, Mass League, and Winchester Highland Management. At this time, I would like to introduce Laurance Stuntz.
Thanks, Tarsha. And thank you all very much for being here this morning. This is another great turnout. We had, last week we had about 150 folk in Dedham. Glad that we were able to come a little bit further west. How many of you came from further west of here? Excellent. So maybe we'll try one in Pittsfield or something like that. Would that be, actually that's sort of good. If folks would, is this sort of, if I give you three options, here, Springfield, or Pittsfield, who would pick here? Who would pick Springfield? And who would pick Pittsfield? All right, Springfield. So, so maybe we'll be going even further west next at the next one of these. But thank you all very much for spending the time to get here this morning. I'm glad, as I was looking at traffic patterns for tomorrow, that it's not tomorrow. Apparently getting to 84 on the Tuesday before Thanksgiving would have taken all of us multiple hours. So excellent planning by the communications group, by Brett Campbell and Rick Kirstens, and thank you very much. All right. So I wanted to spend a few minutes this morning talking about MeHI and where we see our role and where we can, where you guys can help, because I think, you know, meaningful use is a key piece of the overall picture in health information technology adoption, but it's not the whole story, particularly for providers who don't qualify for meaningful use incentives. So a couple things, so I'll spend a few minutes on MeHI. Please stop me if you've got any questions. This is intended as an educational seminar, and hopefully we can make it useful and interactive for you. So briefly, MeHI, the organization, is part of the Mass Tech Collaborative. Mass Tech Collaborative has been around for almost 30 years, focused on innovation and economic development in the innovation economy. So we started in 1982 as a place where the state asked us to help organize a chip fab and design, silicon chip fab and design facility so that students at MIT, Northeastern, Harvard, Boston University, UMass could more quickly and more easily design silicon chips. And so, the Mass Technology Park Corporation was created, and we still actually have a chip fab facility on the campus in Westboro, owned and run by Kopin Industries. So over the last 30 years, we've helped launch and start different centers of innovation. The Clean Energy Center came out of work that we were doing in the mid-2000s. The Life Sciences Center came out of work that out of the Life Sciences Collaborative that we started in the early 2000s. And today there are three institutes at the Mass Tech Collaborative. The first is the Innovation Institute, which is looking at what's coming next. Yeah, the slide is up. And so the Innovation Institute right now has projects in big data, organizing the talent pool around big data, which we think is going to be an economic driver for the state and has significant overlap with healthcare. Robotics is another area that we're working on, and the robotics cluster, I think folks have probably seen Roomba, which is run by iRobot and is the world's largest consumer robot company, based here in, I think they're in Burlington or Bedford. And Vecna is another large, and there are many robotics companies. And advanced manufacturing, there's a lot of work going on what's called advanced manufacturing or nano manufacturing, a lot of work with the UMass campuses and MIT on new modes of manufacturing that are really going to drive the economy and transform our textile mills, our gateway cities, and so on. So that's where the Innovation Institute is working. The Broadband Institute is working on wiring the western part of the state. Actually, in this crowd, I probably have more folks who are familiar with MBI than in Eastern Mass. So we finished the Middle Mile program, putting a fiber network all over Western Mass, and now towns are starting to link into that network. So is anybody here from Leverett, Mass, actually? Anybody live in Leverett? So Leverett is a small town, a couple thousand folks, but they've built a broadband network that connects into the MBI network and allows you to get 30 times as fast internet speed at home in Leverett as I can get in Eastern Mass through Comcast. So I'm a little jealous of the MBI and the work that they're doing, bringing broadband to about 45 unserved towns who don't have any kind of broadband, and another 10 or 20 towns that are only partially served through their mission now, bringing fiber to the home networks or linking all of that. So that's the Broadband Institute. And then MeHI this is sort of the list of things that we're charged with by statute. I boil it down to helping to support innovation in healthcare through the use of technology. So, we've been talking a lot about health reform, we've been talking about cost reduction, about quality improvement, and technology has a big role to play. It's not the only, driver of that by any stretch of the imagination, but it does have a big role to play. It's helped every other industry where technology has had huge adoption. I was just talking this morning, our lives have changed tremendously through the use of smartphones, through the use of mobile technology, through the use of integrated networks and the internet, and that revolution is really coming to healthcare right now. And MeHI's responsibility is to help organizations like yours figure all this out, help support innovative projects. And I'll talk a little bit about the areas there that we are focusing on in the next couple of slides. Any questions on MeHI or any of the other pieces? Okay. So MeHI's sort of broad vision for where we can provide the most value is, MeHI in Massachusetts should be the global eHealth leader. We have all the ingredients. We have world-renowned facilities and provider organizations. We have a highly educated and highly workforce. We have a lot of university talent. We've got a population that has health coverage, higher health coverage than any other state in the country through the ongoing health reform efforts that we've had. And bringing all those pieces together gives us the opportunity to really do some interesting and innovative things in healthcare. So our specific mission is to engage that healthcare community, all of you, with the vendors, with the universities, with patients, and help catalyze innovation in this area. And then specifically, we're working on 4 broad-ranging goals. The first is getting every organization, every healthcare organization, healthcare provider, healthcare payer. Payers aren't adopting EHRs, but they're connecting to EHRs. All the providers are adopting EHRs, getting all the data, all the health data in the state to be digital. We want to use that digital data and connect it and share that, all that data, make it shareable, and encourage folks to share information among each other. And that's what we mean by the 100% interoperable EHRs. We're using all this to support health reform, and really the piece where we see the biggest potential is really in starting to engage consumers in the management of their own health. So we're starting this with the Mass Highway and working on consent and helping people understand what does it mean to share your information with your doctor, to have your doctor share your health information with each other, and to really understand and engage with your health information. And that's sort of where I see the next wave of our deep activity is going to be on consumer engagement. And then as an economic development agency, we also have a role to play in the eHealth sector, the digital health sector, helping these companies grow and expand. So there are about 250 software companies based here in Massachusetts that are in the health IT or digital health or eHealth space. All of them are going to become, some of them are very large already. Everybody knows of folks like Philips, EMC, Nuance, InterSystems, eClinicalWorks, Meditech, Athena Health. All of these are large, 100 million plus, or in some of those many billions of dollars, large companies employing a lot of folks in Massachusetts. We want to keep that growing, but we also want to grow the startup economy as well. So that's sort of on our economic development mission. So take a step back and talk specifically about how we're doing on meaningful use, because this really is the foundation of exchange of information. In order to achieve innovation, achieve the use of technology or leverage technology in order to reduce cost or to improve quality, the data have to be in digital form and able to be shared. So how are we doing? So about 79% of Massachusetts providers, according to our recent survey, that's probably gone up, but the survey that we did last year, have adopted EHRs. Virtually all hospitals have adopted EHRs. Most primary care physicians, 96% of primary care physicians have adopted EHRs. So that's the good news, and you can read the stats, top 10 in the country in terms of health IT adoption, meaningful use participation. There's about $850 million that has poured into the system for technology adoption. That's all great. If I go to the next slide, we talk specifically on meaningful use. About 85% of the estimated 23,000 physicians and hospitals and nurse practitioners, the eligible providers, are participating in the Medicare or Medicaid incentive programs. About 80% of those have made it to stage 1. Only about 7% of them have made it to stage 2. So it's encouraging to, on Tarsha's question, to see that many of you all are testing to stage 2 this year and working against that, and so that number is going to climb. And I think as folks may have seen the countdown clock out there, if you're a Medicaid provider and haven't started the process, you've got a little bit more than a year to start it. Next program year is the last program year in which you can start the process. And then on the hospital side, virtually all. I think there are 3 hospitals, the 2 Shriners hospitals and Mass Eye and Ear, who have not yet attested to adopting, implementing, or upgraded their EHR. There are only a couple, Nantucket and Martha's Vineyard, who haven't yet made it or fully attested to meaningful use. All the rest are at meaningful use and moving on to future stages. So we're making it, pretty far along on the physician and hospital side. Highway usage, I think folks actually, out of curiosity, how many folks are connected to the highway? How many of the folks here? How many folks are working on it? Okay, so about 10% and 20%, I would say, which is more than typical. About 10% of the organizations, about 500 organizations in the state, 530 according to this slide, are connected or participating in the are connected to the highway, and about 85 are in process. and then there are about 200 who are actively using the highway. We think there are around 5,000 organizations in the state who are likely to join over time, so this is just a small percentage so far, but what we are seeing is that the large organizations, about 75% of the community hospitals, about 50% of the large integrated delivery networks, almost all the large ambulatory providers, I think it was 90% of them, are connected to the highway and actively using it. And so the chances are that if you want to trade with one of your large trading partners, you're going to be able to start now. So I would encourage you to do so. So I talked a lot about physicians and hospitals. That's the good news. One of the things that we've been struck by as we've done our survey and as we're designing our programs is that it's obviously not all of the healthcare system. So there are three main sectors of the healthcare system that have not yet fully adopted, or at least not as much adopted technology. The two first ones are behavioral health and long-term and post-acute care. In our survey that we did last year, and I don't have a slide on it, but I'll talk actually in the context of this slide. So in the bottom left here, the eHealth Equality Program is designed to help those two groups of providers adopt technology. There's about 55% of each of those sectors had adopted technology. So we created what we call the Equality Incentive Program, which was modeled on meaningful use, although we don't have nearly as many dollars as were available to the federal government. We're helping about 40 organizations and about 220 clinical sites in behavioral health and long-term post-acute care adopt EHRs right now. So that's in the Equality Incentive Program. We are looking to figure out the best way to expand that program and increase its impact. But you know, the behavioral health and long-term post-acute care are key sectors of the economy, of the health economy, and supporting them and getting them up to parity with physicians and hospitals is a key piece of our mission. And basically, that's the sort of, from the sector perspective, is our most important mission. I'll talk briefly about connected communities. Connected communities is an area that is really where we see this support going next. We expect to, we're just about to announce 9 different demonstration projects all across the state. Each of these projects had to involve behavioral health or post-acute care, and to include exchange of information among organizations who are not connected together. So these demonstration projects through the Connected Communities program are really going to show how can we focus on particular problems in a community and help organizations in that community exchange information and share information. So I'm really looking forward to updating groups like this and other folks on the progress of that initiative. The eHealth Services and Support Group that Tarsha leads is really our hands-on area. You know, this is the group that provides educational services, provides hands-on support, provides help with PQRS registry support, provides help with meaningful use adoption, includes the Medicaid pre-audit group that are helping many of you, finish up your applications, get your incentive payments, all of that. And then finally, the eHealth Cluster Development Initiative that I talked about. So I'll dig a little bit into what we're doing in eHealth Equality, and we can go from there. So the eHealth Equality program is specifically around behavioral health and long-term post-acute care, as I mentioned. The other group that we're starting to take a look at as well is home health care. We recently sponsored a survey of home health organizations for technology adoption, and are expecting to announce the results of that hopefully in December. And we did that in collaboration with the Home Health Alliance of Massachusetts. And the whole point of this program is to help get organizations who weren't traditionally and were not funded by meaningful use onto electronic health records. One of the key things that people recognize is that integrated care is the way to, more integrated care is the way to improve the overall quality of the healthcare that's delivered, as well as sort of not really tangentially, but as a follow-on benefit, it has the potential to improve and reduce the total cost of care that we're delivering in the system broadly. So in this year, we're rolling out the EHR adoption toolkit to small providers, helping providers understand what they should go through, what are the steps to adopting an EHR in these spaces, and as I mentioned, the eHealth Equality Incentive Program. The Connected Communities Program, as I mentioned, has goals to catalyze collaboration and advance the adoption and use of technology to improve information sharing in healthcare. We've divided, in collaboration with the Health Policy Commission, actually we leveraged and just used the Health Policy Commission's statistical secondary service areas to define communities that are focused around referral circles. So, if you happen to be in the Berkshires, virtually all of your care is now delivered through your tertiary care is delivered through Berkshire Medical Center, and then they have collaborations with Bay State as well as back to Boston. But part of what we see as a goal for healthcare is keeping people close to home and improving the sharing of information. So the Connected Communities work is about that. We worked last year to identify, to help each of 15 communities, I think we got 13 of them done, to identify community priorities. Those are posted on our website. So if you live out in Western Mass and go to the MeHI website, or you go to any of these communities, you can find who participated in a bunch of community roundtables and interviews, as well as community plan development and community priority development. And then in each of these communities, we have community managers who are living in the community. So Andrea Callanan, is Andrea here today? Nope, doesn't look like it. Andrea Callanan lives out in Northampton and is responsible for the Pioneer Valley community, as well as the Berkshire community, as well as the Central Massachusetts community. We've got a job share with Stephanie Bryady and Mary Beth Schoening, who live down in Chatham and South Dartmouth, respectively, and they're responsible for the Cape and Islands and Southeast Mass, and then Keely Benson is responsible for Boston and Metro West and the Northeast of the state. And so those community managers, in conjunction with the folks on Tarsha's team, can really answer a lot of your questions around health IT adoption, and their job is to really help organizations connect to each other, as well as identify community priorities and help folks work on those. And then the eHealth cluster development, I'm not going to talk a lot about eHealth services because that's the balance of the day, but the eHealth cluster development is really designed to help leverage our native strengths around technology development, software development, the talent that's produced by our universities, the subject matter expertise that's produced by both our provider groups as well as the large companies that are here, and to really sort of bring people together and unlock new opportunities for growth in this area. We focused that on 3 core areas. One, cluster convening, just bringing people together to learn from each other and network together. Improving access to market. The idea here is really to help support pilots of innovative technology and help healthcare providers make it easier for them to pilot technology without as much of a burden on the healthcare provider, and helping technology folks with understanding healthcare. And then the Healthcare Data Initiative is a collaboration between us and the Innovation Institute's Big Data Initiative. It's really designed to unlock the power of the public data sets that we have available. A lot of data that are in public health, that public health has, that Health and Human Services has, that CHIA has, and help just organize bringing entrepreneurial talent, tech talent to take a look at that data and help the state really grow its understanding of data and unlock innovation opportunities. So that's really on the early stages, the eHealth cluster development. So that's the 20-minute overview or 25-minute overview of MeHI. Happy to, I'm going to black out my face, sorry. You guys can see me. You don't need to see a picture of me as well. But love to entertain any questions, answer anything about MeHI, about anything that we're doing in health reform, about meaningful use, anything.